Good day, everyone. We are NLM 201 Team 6, and we are going to simulate about the case of medical futility. To start with, let me first introduce myself and my groupmates and the role we are to play in this simulation. I am Janica Ribalde, and I'll be playing the role of the ethical consultant and unit nurse. Lisa Legaspi Paine as Mr. Abdul's wife, Anzali Gadal as the attending physician, Jasprit Kaur as the nurse manager, and Ravinder Kaur as the institution lawyer. This is about Mr. Abdul, a 50-year-old male married with two adult children. He came to the hospital for removal of benign tumor, but contracted a brain infection following surgery and became comatose. He is currently intubated and connected to mechanical ventilator. For the past weeks, Mr. Abdul has been showing no signs of improvement. Doctors concluded that this case is considered futile and advised for management cessation. Let us all watch what happened next after Dr. Anzali shared this information to Mr. Abdul's family.
Good morning, Mrs. Abdul. Can I have a moment? I just want to talk to you regarding your husband's condition.
Sure, doctor. How's my husband? Is he getting better? When is he gonna wake up from coma?
Mrs. Abdul, based from our assessment from the previous weeks after his surgery, he has been showing no signs of improvement and relatively deteriorating after all the management we have done. I, together with the other doctors that's taking care of him, have concluded that Mr. Abdul will never regain consciousness anymore, and we advise that ventilator and feeding tube that is keeping him alive and requiring around-the-clock care can be removed because this is just making him more suffer.
No! What are you talking about?
Sorry, Mrs. Abdul, but we cannot do anything for your husband anymore.
No! That is not right. You are disrespecting the sanctity of life. Go away! I don't need your advices here.
Mrs. Abdul, I will leave you and your husband for a while. I hope you could think about what I have said and reconsider my advice.
That doctor is out of her mind. I will not let her kill my husband. Our body is the temple of the Holy Spirit and reflection of God's image. Human life has innately sacred aspect that should be preserved and honored at all cost. I will appeal this to the court, and I will make sure no one will hurt my husband.
I understand how you're feeling, Mrs. Abdul. Given the situation, it is really very difficult on your part. I'll leave you for now and come back later for your husband's medication.
Thank you, nurse.
Hi, Miss Jaspreet. I just want to talk to you regarding what Mr. Abdul's wife told me earlier. She'll be seeking help from the court to stop the plan of putting off her husband's life support. And I personally wanted to speak up on behalf of my colleagues in the unit. This situation is really stressing us out. We were put in a situation of doing things against our standards of profession. Miss Jaspreet, what should we do?
I understand. It is really very hard for you as well. I will be talking to Dr. Anthony to discuss about this matter. Good morning, Dr. Ansley. I have an important matter to talk to you. I think we have to seek advice to the legal and ethical consultant of our institution. Mrs. Abdul is planning to move forward to stop the plan of putting off her husband's ventilator. She mentioned to one of our nurses that she will be appealing her husband's case to the court.
Really? She's making things big and forcing us to work beyond our standards of practice. Yes, I think we have to arrange a meeting with Ati Rabinder, our institution lawyer, and our ethical consultant, Miss Danica.
Right away, doctor. I will be arranging a meeting as soon as possible. I will be get back to you once everything is set.
Hello everyone. I received a request regarding a futility case from one of our patients in the ICU. Dr. Anzali, were you able to discuss this with the family already?
I haven't heard from his two children about their opinion regarding this matter, but I have already talked to Mr. Abdul's wife and she was furious about it. She did not let me finish my explanation. She was so angry and would constantly say no.
Do we have any laws governing this matter, Attorney Ravinder?
According to Healthcare Consent Act, if an individual is not capable or competent in providing a decision, like Mr. Abdul, the role of being a decision maker will then be played by the family members, which in this case is her wife, which at the same time is also being mentioned in the Substitute Decision Makers Act. It also specifies that healthcare members are not authorized to make decisions for their clients with an exemption of an emergency.
But this case is a medical futility. The goal of medicine is to uphold the principle of beneficence in helping the sick. Physicians have no obligation to offer treatments that do not benefit patients.
That is right. This act does not address consent for futile care. Therefore, it can't be used as defense for her wife's appeal.
Futile intervention may increase a patient's pain and discomfort in the final days and weeks of life, give patients and family false hope, delay palliative and comfort care, and expend infinite medical resources. Besides, what she wanted us to do is against our standard of practice and against our principle of non-maleficence, doing no harm.
Physicians have the ethical authority to withhold or withdraw medically futile intervention. We could relate this to the utilitarian ethical theory where we choose the option that yields the greatest benefit to most people. In this situation, communicating with your professional colleagues involving patient care and with patient's family greatly improves the experience and outcome for all.
This case also raises a concern to the nurses of this unit. They will be put in an incriminating situation which may also cause a moral distress on their part.
That's right. We are in a dilemma which makes us feel guilty of prolonging a patient's suffering, but on the other hand, would like to advocate Mr. Abdul's wife's decision and religious belief, a conflict of conscience that can later turn to moral distress on our part.
So what I think we should do is that Dr. Nzali, you must communicate openly with Mr. Abdul's wife and his two adult children about the interventions that are being withheld or withdrawn and to explain the grounds for such decisions. It is important to approach such conversation with compassion. For example, rather saying to the family, there is nothing I can do for your husband, it is important to emphasize that everything possible will be done to ensure the patient's comfort and dignity. The wife may still turn down the medical advice, but having his two adult children who can be more open-minded to understand the situation during the discussion of patient's condition might help the whole family accept and further understand the physician's advice is actually to prevent complication and alleviate further sufferings for Mr. Abdul. And for nurses, I know, it is morally distressing, but we have to give the family the time to contemplate and be with Mr. Abdul for quite some time, to have closure with their loved ones. Let us all be guided with the Code of Ethics for Nurses and the Code into practice with the Canadian Nurses Association, which offers assistance in utilizing variety of decision-making models. Through this flow process, you will be able to find composure and knowledge on how to best deal with such issue. We will prioritize being accountable, fair, and focus on the health and well-being of Mr. Abdul even in the process of death.
You pointed it right, Miss Janika. I will be talk to the ICU nurses to refocus them, not into the issue but on the provision of comfort, engage in active listening and discussion with the family members. It will be greatly helpful to the acceptance of the situation.
Medical futility has been a long overdue debate within medical, legal, and ethical committees over the years. Confusion has still surrounded this concept of how and when to consider a certain case medically futile. In the case of Mr. Abdul, we utilized the utilitarianism ethical theory in our decision-making process, wherein the option that yields the greatest benefit to the most people is the one that is ethically correct, which in this case is turning off Mr. Abdul's life support. It does not only alleviate further suffering for Mr. Abdul, but also relieve the healthcare professionals' moral distress and avoiding wasting resources for inappropriate management. This is also supported by the ethical principles of beneficence, which is doing what is good, non-maleficence, doing no harm, and justice by providing least harm to the patient and avoid further complication and suffering. Legal rules that can be related in this case are Healthcare Consent Act of 1996 and the Substitute Decision Makers Act of 1992, where it both stated that if an individual who is not capable or competent in providing a decision like Mr. Abdul, the function of being a decision maker will then be given to a family member, which is her wife. But this act does not address consent for futile care. Therefore, it can't be used as defense for the wife's appeal. Nurses can strengthen the focus on the patient when further treatment is deemed futile. In caring for Mr. Abdul, nurses must prioritize being accountable, fair in providing care, and focus on the health and well-being of Mr. Abdul even in the process of death. This simulation also encouraged nurses to keep lines of communication open and find ways and means such as calling for patient conference or involving clinical ethics committee to have rational dialogue. The importance of nursing presence at family conference is paramount. Nurses are most often privy to the hopes, wishes, and emotions of patient and their loved ones. Using this privileged knowledge, nurses can share, advocate, and seek to fulfill those wishes to the greatest extent possible. When care is the only treatment remaining, nurses can respond with understanding, composure, and effective communication. Armed with the intent of the values of the Code of Ethics for registered nurses, nurses can move forward and take action when challenged by difficult ethical situations related to futility. This is NLM 201 Team 6. Thank you so much.